Thank you, Carol. It's my great pleasure to be here today and to talk about a project that I've been working on for a couple of years, and it involves a group of people that are at especially high risk of developing cancer. And I'm going to talk a little bit about a surveillance program that we've developed to try and detect cancer at an earlier stage in this group of individuals. So for most cancers, we don't understand why they happen. They arise and we really don't have an explanation. But for about 5 to 10% of cancers, and we're understanding more of this as we go along, so for about 5 to 10% of cancers, we know that there are gene changes that have occurred within our bodies that are hereditary, that predispose us to getting cancers more readily than other people. And we think of, when this has happened in families, we think of these people as having familial cancer syndromes, also called cancer predisposition syndromes. So the most well-known of these is probably the hereditary breast and ovarian cancer syndrome. And this was brought to prominence by Angelina Jolie back in 2012, I think it was, when she announced that she in fact carried a change in the BRCA1 gene that predisposed her to a high risk of cancer. And she in fact made the decision to have risk-reducing surgery and had her breasts and her ovaries actually subsequently removed. So as a little bit further background to this, in Australia at the moment, for women that have gene changes in the BRCA1 or 2 gene, EviQ, which is the peak clinical body that recommends how people with familial cancer syndromes should be managed, EviQ recommends that BRCA1 and 2 women have an annual breast MRI every year. And the government agrees that this is a good thing to do, and this is rebated by Medicare to the tune of around $700. And the magic number that I want you to look at here is 2%. So in 2% of women that are screened, in these high-risk women, in 2% of cases a cancer is picked up. So for every 100 women that are screened, we pick up 2 cancers. So I just want this as a little bit of background for the things that I'm going to talk about as we move forward. So I want to talk about a syndrome called Li-Fraumeni syndrome. It's a little bit of a mouthful. It's named after the 2 clinicians that first described the syndrome. And this is a syndrome where people are predisposed to a large number of cancers. It's caused by changes in the TP53 gene, and people that have this gene change have a 90% risk of getting cancer by the time they're 70 years of age. And in fact, if you separate out the genders, women have in fact almost 100% chance, and it's a little bit less for men. The thing about Li-Fraumeni syndrome that makes it a little bit different is that you can get cancer anywhere in the body. It predisposes you to many different cancer types. So unlike hereditary breast cancers and hereditary bowel cancers, for instance, rather than just being able to screen one organ in the body, it requires looking at the whole body. The most common cancers that we see in Li-Fraumeni syndrome are sarcomas, and they can be bone or soft tissue sarcomas, and they can occur anywhere in the body. And also breast cancer. Brain tumours, adrenocortical tumours, there's a whole myriad of cancers that occur within these families. Not only can you get lots of different sorts of cancers, they also occur at young ages, and families are devastated often by the disease that happens in these families. So this is a reasonably typical family tree for a Li-Fraumeni syndrome family. You can see the grandmother here having a breast cancer at 47. And if you carry the gene change in P53, you have a 50% chance in each of your pregnancies of passing it on to your children. So you can see that in this family, in fact, 3 of the 4 children were all born with the gene change as well. And you can see that there was a breast cancer that occurred at 47, a brain tumour at 41, another breast cancer at 37. So these cancers are occurring at quite young ages and are quite devastating. And then even more so in the subsequent generation, the grandchildren, you can see that 4 of the 5 actual grandchildren have inherited the gene change to this state, with a leukemia at age 6, brain tumour at age 4, and sarcomas at less than 10. So it's really devastating. These families can be quite heartbreaking. So we wanted to try and make a change for these families and try and see if we could offer something that was going to improve the outcomes. So as I said previously, there are well-established screening programs in hereditary breast cancer and hereditary bowel cancer, but there's no screening for people that have Li-Fraumeni syndrome. And I think in the past that's been due mainly because you can get cancers throughout the body. So it's not an easy thing to be able to screen the whole body, but imaging technologies have advanced to the point now where it is actually possible for us to do a whole body MRI scan. And so we set up a research project that has involved screening people using whole body MRI. So it's an annual scan that people undertake. It takes around 2 hours, so it's not a trivial thing, and you're wheeled in and out of the MRI. And there's no Medicare item that covers this at the moment. So our research study is covering the costs of the scan, but if somebody requested a whole body MRI, it costs around $2,500 at least, with no Medicare rebate on that at the moment. So it's really not affordable for your average person to be able to do that every year. And bearing in mind there's often multiple members of families that are involved as well. So we wanted to see if we could use whole body MRI to try and pick up cancers at an earlier stage and make a difference for these families. So our results so far. So we have 31 people actually that have been enrolled, and we've screened 27 people. So 27 people have had at least one whole body MRI. We've got both males and females involved, and they range in age from about 18 to 63 years. So we have a broad age cross-section. And incredibly, we've detected 3 new cancers in this group. So I asked you to remember the magic 2% number that gets picked up when we do breast screening for the high-risk women. In our cohort at the moment, our pickup rate is 11% in this high-risk group. Our numbers are small, but I can tell you that we're collaborating internationally as well, and there are quite a number of similar studies that are running in France and the US and the UK, and their pickup rates are actually similar to ours. So in this high-risk group, the technology seems to be working very well. So to give you some more details about the 3 cancers that we have picked up, the first patient was a 52-year-old female. She had had breast cancer 3 years previously, and on MRI there was a region of concern in her lower back, and that turned out to be a liposarcoma. You can see the pictures of that here. This area here was a region of concern. This is the same region with 2 different images, and this little hyperintense nodule was the thing that was of concern. It turned out to be a liposarcoma. The second patient was a 41-year-old male. He'd in fact had an osteosarcoma when he was 12, and his MRI showed up a prostate cancer with a Gleason score of 7, which is reasonably serious. The third patient was a 47-year-old male. He'd had stomach cancer a few years previously. Again, we picked up a prostate cancer, which isn't a cancer that we think of as typically part of the Li-Fraumeni syndrome, but nevertheless, there it was. So I'm pleased to say that each of these patients went on to be treated curatively. So that was fantastic for them and fantastic for us. And another thing to note is that each of these cancers, there were no symptoms. So if the screening hadn't have taken place, these cancers wouldn't have been picked up at this stage until things had progressed. So just in finishing up, I thought I would outline some of our future plans. So we're going to continue our study where we have funding to be going for a little bit longer yet, and we've applied for some more funding as well. Because Leigh-Fraumeni syndrome is quite rare, we're collaborating internationally, and we're part of what is called the Leigh-Fraumeni Exploration Consortium. And you can see indicated here on the world map where each of our collaborators is, and there are whole body MRI studies that are ongoing in these centres as well. And our plan is to maximise the impact, I guess, of our findings, and we're thinking of the best ways to go about that by collaborating internationally. We've already published reasonably widely on our thoughts in this area, but we will go on when the results of our study have come to fruition. We will go on and publish those. And then if the results of our study are positive, and we've every reason to believe that they're going to be at this stage, in conjunction with EviQ, we'll formulate some screening recommendations for Leigh-Fraumeni syndrome moving forward, so that there's a recognised clinical framework that these people can be managed within. And then, of course, we'd like to apply for a Medicare rebate, so that should whole body MRI prove a good thing in this population, and it seems it's going to, that the costs will be rebated, so that the scans are going to be readily available. So in finishing up, it's a fantastic project to work on. You get to know the families, and it's really a wonderful thing to see the impact that you can have in people's lives, and I'm hoping that we can impact more broadly on these families positively as well, and I think we'll be able to. So thank you for your attention. I'm happy to answer any questions.